Hi, my name is Nisha Magnet, and my presentation is on pneumonia. What is pneumonia and what are the causes? Pneumonia is an infection in the lungs that affects either one or both lungs and sometimes just a certain lobe. With pneumonia, the air sacs, alveoli, may fill with fluid or pus and can become solid. When alveoli are filled with fluid or pus, it makes it more difficult to breathe and limits the oxygen intake. The causes of pneumonia can be a wide variety of bacteria, viruses, and fungi in the air we breathe. Another reason pneumonia can occur is by inhaling a liquid or chemical, which is called aspiration. Signs and symptoms are different in every person and can vary from mild to severe. And different types of pneumonia will develop in different ways, whether it be gradually over a period of days or suddenly without much warning. Signs and symptoms of pneumonia may involve a cough, which may produce greenish, yellow, or even bloody mucus, fever, sweating and shaking chills, shortness of breath, rapid, shallow breathing, sharp or stabbing chest pain that gets worse when you breathe deeply or cough, loss of appetite, low energy and fatigue, nausea and vomiting, especially in small children, and confusion, especially in older people. How is it diagnosed? Even though it can be difficult to diagnose because the symptoms are so variable and can be more or less the same as the flu symptoms, there are still many ways to diagnose it. Your doctor will listen to your lungs with a stethoscope. If you have pneumonia, your lungs may make crackling, bubbling, or rumbling sounds when you inhale. Your doctor may also hear wheezing and may find it hard to hear sounds of breathing in some areas of your chest. Chest x-rays are great for looking for inflammation in the lungs. A chest x-ray can be the best for diagnosing pneumonia. However, this test won't tell your doctor what kind of germ is causing the pneumonia. Blood tests such as complete blood count to see if your immune system is actively fighting an infection. Sputum test, your doctor may collect a sample of sputum and send it off to the lab for testing. This will help your doctor find out if a bacteria, virus, or fungi is causing your pneumonia. Treatments for this disease. Treatment for pneumonia depends on the type you have, how sick you're feeling, age, and other health conditions. Tests they use to diagnose you will determine what kind of pneumonia you have based on the type of bacteria, virus, or fungi. Viral pneumonia will need antiviral medication to treat because typical antibiotics will not work against viruses. Bacterial pneumonia is usually treated with antibiotics, but the specific choice of medication depends on a few factors such as general health, age, and other medications you might currently be taking. And antifungal medication would be prescribed if a fungus is the cause of pneumonia. How can pneumonia be prevented? You can reduce the risk of pneumonia and use all these steps in order to prevent it. Getting a flu shot every year to prevent influenza because the flu is a very common cause of pneumonia. There are also several other vaccines to prevent other infections that can occur to cause pneumonia. Wash your hands frequently, especially after blowing your nose, going to the bathroom, diapering, and before eating or preparing foods. Don't smoke. Smoking tobacco damages your lungs' ability to fight off infections, and smokers are at higher risk for developing pneumonia. How's the outcome? The outcome in pneumonia can be variable since pneumonia can be classified and characterized in different ways. Healthcare professionals often refer to pneumonia based upon the way the infection is acquired, whether it is hospital-acquired, community-acquired, bacterial, viral, fungal, or walking pneumonia. The outcome can be different in every person. Complications can also occur such as sepsis, pleural effusion, and empyema. Other variables such as age, background of the patient, setting, culture, weight can all affect the outcome of pneumonia. There are also 4 different stages of pneumonia that I'd like to include. The first stage is consolidation, which occurs in the first 24 hours as cellular exudates containing neutrophils, lymphocytes, and fibrin replaces the alveolar air. Capillaries in the surrounding alveolar walls become congested. The infection spreads to the hilum and pleura fairly rapidly. Pleurisy occurs, marked by coughing and deep breathing. The second stage, red hepatization, which occurs in the next 2 to 3 days after consolidation. At this point, the consistency of the lungs resembles that of the liver. The lungs become hyperemic. Alveolar capillaries are engorged with blood. Fibrinous exudates fill the alveoli. This stage is characterized by the presence of many erythrocytes, neutrophils, desquamated epithelial cells, and fibrin within the alveoli. The third stage, gray hepatization, which occurs in the next 2 to 3 days after red hepatization. This is an avascular stage. The lungs appear gray-brown to yellow because of fibrinoprelent exudates, disintegration of red cells, and hemosiderin. The pressure of the exudates in the alveoli causes compression of the capillaries, and leukocytes migrate to the congested alveoli. The fourth stage, resolution. This stage is characterized by the resorption and restoration of the pulmonary architecture. A large number of macrophages enter the alveolar spaces. Phagocytosis of the bacteria-laden leukocytes occurs. Consolidation tissue reaerates and the fluid infiltrates, causing sputum. Fibrinous inflammation may extend to and across the pleural space, causing a rupture by auscultation, and it may lead to resolution or to organization and pleural adhesions. The outcome of the disease depends all on the severity, whether it can be treated or not, and what kind of pneumonia you have, of course. CNA care. The nursing assistant's main responsibility in caring for any patient/resident with a respiratory problem is observation. Since we are the ones that will spend the most time with them, we will be the ones that have the best opportunity to observe signs that a person may be having problems. Promoting comfort is the next best thing we can do. While there's a lot we can do to help promote comfort, we have to make sure that the doctor has not placed any restrictions on fluids, because encouraging water intake is good to help thin secretions so they're easier to cough up, therefore making the patient a bit more comfortable. Positioning can also help a lot, like moving the patient to fowlers, semi-fowlers, or high fowlers, or leaning them forward using pillows on the overbed table. Another very important thing is providing frequent oral care, because this can help the person become more comfortable and will reduce the number of microbes in the mouth.